You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. In fact, according to my first guest, he says no more dentures. Nobody should be wearing a loose-fitting denture. And people that are headed for dentures, he has good news. And with us on the show, we have board-certified oral surgeon, Dr. Moss. Dr. Moss, welcome to the program.
Thank you, Randy. Thanks for having me.
I have lots of questions, by the way, about the process. But for people that don't know your center, I guess you have one of the largest centers where you are. Who's a typical patient and what are the different services you offer?
We offer a variety of services. Most of them are dental implant related. We focus on patients that need all of their teeth replaced. So your typical denture wearer that's looking to get out of dentures, or the person that's about to lose their teeth, and that's more typical. So that's the person that's 60 years old, they're still working, they've suffered their whole lives with periodontal disease, and now their teeth are on their last legs, so to speak. And they're being told, you are going to lose these teeth, and they're so fearful. What am I going to do? How am I going to show up and work Monday with dentures in my mouth?
So they don't want false teeth, obviously.
Absolutely
Nobody
not,
wants.
Randy. Nobody wants false teeth. That's an archaic technology.
You hate, I don't want to put words in your mouth, but you do not like
You know me.
dentures.
I don't like dentures at all. To me, dentures are archaic. George Washington had dentures. I doubt very much they were made of wood. We know what happens to wood when it gets wet, right? But dentures haven't really evolved much since then. We're still putting these plastic pucks with teeth on them in patients' mouth and expect them to function and to chew. Dentures, to me, you know, today, Randy, we have such sophisticated prosthetics. We've got hands and limbs that are lifelike and move, can be attached to muscles and can pick up glass and drink, and we're still giving patients dentures. That's like somebody who, let's say a diabetic, needs a below-the-knee amputation, and they're going to get a false leg, and the doctor says, well, we're going to give you a peg leg,
Yeah.
or you need your hand replaced and they're going to give you a hook. Well, you might as well give them a parrot on their shoulder and a patch on their eye because they're going to stick out like a sore thumb. Dentures, to me, are old technology.
So according to you, I mean, people come in with bad gums, bad teeth that need to be replaced, and you, on the day of the procedure, I want to get this straight, they walk out with a fixed set of teeth that don't come in and out.
Yes.
Is that right?
That's correct. You sound a little skeptical, and I was too when I first heard about it. You have to realize that implants have evolved since they first were discovered or introduced in this country since the early 80s. Most of the technology was pioneered in Europe. All of the great innovations with implants come from Europe. We've struggled for decades here with particularly these patients that need all of their teeth replaced. They don't have enough bone. We thought implants need to be straight up and down. Why? Because God or Mother Nature gave us roots that are straight up and down, and we just assimilated from that. Turns out we're not right. Implants bond to the bone so strongly that they can be placed on angles, and we don't need an implant for every single tooth we're replacing.
And we should mention, by the way, you teach doctors, oral surgeons, all over the world. What we're talking about today, is that correct?
That's correct.
I mean, you have a big training facility, but you lecture all over the country.
We do. Now I do, and I can,
teaching implants.
Yes, and I could tell you how that came about, and it's part of the story I was just telling. In 2008, we do a lot of implants in my practice, thousands and thousands, and very complex cases. But we're frustrated by these cases where patients need all their teeth replaced and they don't have enough bone.
Okay.
Again, we're taught in our residency programs and these gurus that run these programs that we need 6 or 8 or sometimes 10 implants to support a full set of teeth. It took a guy like the fellow that I'm now partnered with, Dr. Mallow, who pioneered this procedure called All-on-4, and that simply means all of your teeth placed on only 4 dental implants. Well, that's been a revolution. Why? Because we thought we needed 6 or 8. We thought they needed to be straight up and down.
So it's less expensive, by the way, with less implants.
Of course it's less expensive.
Okay.
It's half as expensive than if you had 8 implants.
And if they're strong, I mean, you could eat whatever you want?
They're very strong. They physically fuse to the bone. So once they're inserted and they've had that biological bond, you couldn't unscrew it if you wanted to. You'd have to take a treff line and core it out. Of course, you wouldn't do that. So we now know, decades later, since implants were introduced, that we
now
only
these
need
people
4.
though that come in and they have a mouth that's a mess, broken down or whatever, and they're taken out. And you give them a set of teeth, and they go home. How soon can they eat?
That night.
Really?
I said it. That night. Another one of the innovations that come along with this All-on-4 procedure, Dr. Mallow and the company he was working with, Nobel Biocare, they were able to taper the tip of the implant. So now we could prepare in bone that's soft a small hole and drive a wide implant into it. It's like a molly that expands.
Does it hurt though? It seems like it would hurt.
Because we're preparing the site under irrigation, that's coolant, and the bone's not being heated up, we don't see a big inflammatory response, of which pain and swelling are part of. So it's a little bit counterintuitive. Oh, you're going to drill in my jaw and put a screw in there. It's got to hurt. It doesn't. Most people don't even take the pain pills we write for them. They use Advil or Tylenol.
Is that right?
That is exactly right.
So the next day they could eat if
that
they want.
night they could eat. Now,
Like,
you can't snap into a Slim Jim the first night. We don't have that biologic bond, but they could eat regular foods that's not too chewy, well-cooked vegetables, tender meats, things along that nature. They're not stuck to mush like denture wearers or pudding, Jell-O, applesauce. No, regular foods.
Okay, so now, by the way, where you are there a lot of denture wearers?
Well, I'm in one of the densest. Let's put this into perspective. Let's talk about the whole country. There's roughly 40 million Americans without any teeth in either the upper or the lower jaw. So there's 40 million denture wearers out there. It's estimated New York City has about 8 million inhabitants. So that's right on my doorstep, Manhattan, 8 million people. 40 million out of the country is about 12.5%. Even if we're conservative and we say 10% in Manhattan, that's 800,000 people just in Manhattan alone that
have an upper or lower denture?
That could fill Giant Stadium, MetLife Stadium, where the Jets and Giants play 10 times. Now, that's just the people without teeth. What about the tens of thousands, hundreds of thousands more in that city also who's about to lose their teeth? We could fill the stadium again and again and again. That's how many people there are.
Okay, but if implants are so good, then why aren't they, like the denture wearers, why aren't they all doing it?
That's a great question, and there are several reasons. Let's start with the denture wearers again. Denture wearers, they've essentially had all of their teeth already removed. They're kind of out of the system now. They don't see the dentist anymore. Typically, they're relieved about it. They're happy they don't see the dentist. Why, Randy? Well, they remember life when they had their teeth. It was frequent trips to the dentist, back and forth, patchwork here, fix this up, now they need a root canal and a crown, then that fails, so they need extractions, take the crowns off, throw them away, waste the money, put bridges on. Eventually those fail. Crown and bridge has a lifespan of 10 to 15 years. After a while, they feel like they've been an annuity to the dental profession, constantly spending, and
Did they tell you
still
this?
losing
Did they
their
tell
teeth
you this?
all the time, Randy, all the time. So they're fed up, they're frustrated, they've had enough, they want to be done, and when they finally lose their last teeth and get their dentures, they feel relief, they feel like they're done.
So last thing they want to do is see you.
Those patients are typically out of the system. Now you have the ones that are in jeopardy of losing their teeth. Their teeth are on their last legs, right? Terminal dentition, we call that. Those patients now, they're being told by their dentist that they have very few in the way of options, that they're headed for dentures, and they don't want to go there because there's just a lack of knowledge of what can be done with implants, generally speaking. So they don't know, so they're not told. Then, of course, you have the fear of pain, the anxiety of pain, which we just mentioned. Dental implant surgery is not terribly uncomfortable. But many people look in their mouths, they count, oh my God, I'm going to need all these teeth replaced. They think they need one implant for every single tooth, and they say, I could never afford that. So they self-diagnose. That's a big one.
How old can you be?
I was going to get to that. That's next.
Okay.
They self-diagnose and they say to themselves, I'm too old for this. I'm 80 years old. I can't have implants. Well, that's not true. You asked me how old you could be. I have many, many patients that are in their 90s. I've heard stories
Why
of
would
patients
they want
in
to
their
do this?
hundreds.
A 90-year-old. Why would a 90-year-old want to do this?
Randy, it's the same reason you would want to do it. Because they want to look good, they want to feel good, and they want to eat and chew the things they used to love. Just like you or I.
Okay.
80 is the new 70, haven't you heard? 70 is the new 60. So 80 years old,
So they're not
that's
more
nothing
likely
today.
to fall out when you're 80 years old? I mean, the
Really,
data?
it's really not an age issue, it's a health issue.
Okay.
So as long as you're reasonably healthy, rule of thumb, if you can get to my facility, walk down the hall, climb into the chair without being out of breath, you're likely an implant candidate. Doesn't matter how old you are. Who's a poor candidate? There are a few. Poorly controlled diabetics, people on drugs for osteoporosis where they get infusions, which cause the bone to not heal so well. Of course, anybody on immunosuppressive drugs, heavy smokers don't do so well. Not that we don't put implants in those patients, sometimes we do, but they're more likely to have a failure. So you need to discuss that ahead of time.
Yeah, but isn't it true that if you've been like 30 years in a denture, you don't have enough bone to do this?
It's true, particularly the way we used to think and how we're trained here in this country. Again, we're trained implants need to be straight up and down. We've got some anatomical structures in the back of our jaw that are often in the way. The nerve in the lower jaw, and many of your listeners have probably been told this, the sinuses in the upper jaw. What we didn't understand just a couple decades ago is that we could angle implants. We could place them where you still have bone. Most patients don't lose the bone in the front of their jaws. They lose bone more in the back of their jaws. We didn't realize that we could angle implants and connect teeth, and they're just as strong and just as successful as if implants were straight up and down. So that means no more bone grafting, which is another expense.
So it's not true then? That means if you've been in 40
not
years...
True. Not
really?
true
All the
with
time?
this all-on-4 technique. Now, it depends on your dentist. It might be true in your dentist if that's his level of education, that's his experience. He may tell you you can't have implants. I would say go get another opinion. Do some research.
You say you're changing and transforming people's lives. You believe that?
Every day. Of course I believe it. I see it every day. I see the response from patients every day. I hear the stories when they come back, how happy they are, how people can't believe how good they look.
All right.
All the time. Here's a gentleman here. He's a voice actor and also is a radio show host, okay? For about a decade, he has some failing teeth. He's wearing upper and lower partial dentures. And it was driving him nuts because when he's recording his show, he's spending hours and hours every day in the studio editing. What's he editing? His dentures, his partial dentures are clicking, 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 and he can hear it. Now, he goes to the dentist, he says, I'm sorry, Van, you need those teeth removed and there's nothing for us to do but give you dentures. Well, that's his lifelike. That's his livelihood. This guy cannot be in dentures. He speaks just like you do in front of an audience. Well, he heard about us. He came down. He was a little skeptical as well. He came down. I said, Van.
He goes, when you say skeptical, what does he say to you?
He says, look, Doc, I came because I heard your ad. But I've been told by more than one person, 5 or 6 times.
Person meaning another dentist?
Another dentist.
Okay.
That I am not a candidate for implants. And I said, Van, let's take a look. We did a CT scan, and I said, not only can I help you, we can replace your upper and your lower teeth in the same day. In the same day. So he comes in, little nervous, comes in. Same day, we do his upper and lower jaws. Here he is now.
Wow.
Amazing, right? So, the same day, upper and lower, 4 implants in the top, 4 implants in the bottom, fixed teeth attached, permanent teeth attached, non-removable teeth that do not come in and out. Wow, he looks in the mirror, he can't believe it. A tear wells up in his eye, and that's common, Randy.
Nice.
Common. Tears of joy, of course, because they're overwhelmed. You know, it's life back again. Story after story after story. So now this gentleman is spending way less time in the room editing. He's out on the ski slopes in the winter. He's playing golf in the summer, and he's loving life.
But could he eat like a chewy steak?
Anything.
Or like a
anything.
carrot?
Let's talk about your average denture patient again.
All right.
Versus him. They can't eat any of those things you just mentioned. Steaks, chewy foods, raw vegetables, raw fruits, apples, carrots, nuts. He's eating all those things again. Salads with cucumbers and croutons, which he loved and was missing. Again. So corn on the cob, right off the cob.
Popcorn? Could they eat
popcorn, biting through an apple, nuts. Nuts. We ask people to avoid almonds. That's a hard nut, which sometimes is hard on the teeth, more so the crowns and the bridges, but nuts. And there's a lot of people that miss them. Denture wearers can't eat. They grind side to side with those dentures. They can't really chew effectively. Actually, there's very good studies done about the efficiency of a lower denture. If you have all your teeth, you've got 100% chewing efficiency, right? Denture, lower denture, 10%. Just by adding 2 implants to secure that denture, still removable, it's called an overdenture, but just by adding 2 implants, we increase from 10% to 20, 30%.
So you could have like salads, things
Absolutely.
like that.
But they're still coming out at night and the back lifts up a little bit.
So you like fixed. I mean, you like teeth that don't come in and out.
Especially because now we only need 2 more. Only 2 more, we go from an overdenture case to a fixed case. Teeth that don't come in and out at night. No more embarrassing teeth in the jar at night or hiding from your spouse. You wouldn't believe how many denture wearers hide the fact that they wear denture. Women particularly are very good at this. Amazed how many women can get away with, my husband doesn't know I wear dentures. Amazing.
We're going to take a quick break, come back. More about the dental implant process, what they can expect on day 1. You're watching The Wellness Hour. I'm Randy Alvarez. We'll be right back.
Before, I had a partial upper and a partial lower. And when I spoke, especially if I be doing a voiceover, a narration, whatever the case may be, they would move. People ask me if I'm happy. My reaction is very simple. I could not be happier than what I am. As I said, this is probably the single best thing I've ever done for myself. And there's just no looking back. You know, it's looking forward at this time. I feel a lot better about myself, and I definitely feel a lot better about my smile. I'm not afraid to look at people and just give them a nice big smile. And I can't tell you, honestly, I'm not kidding, how many compliments I've received. What did you do? You know, from people who don't know what I did, okay? You look different. It's my teeth. See? I look at myself and I start smiling. It's like, uh-oh, what are you smiling for? I like the way I look when I smile now. That's basically it.
You're watching The Wellness Hour. I'm Randy Alvarez. Today's topic, no more dentures. According to my first guest, that if you've been told your teeth have to be extracted and your only option is dentures, he says you need a second opinion because just about everybody's a candidate for dental implants. Is that right?
It's true when you're replacing all of the teeth. Maybe not the case when you replace one or two. Those cases still sometimes you need grafting. But we're focusing really in our practice about all the teeth being replaced. And today, we're talking about all on 4. All of your teeth on only 4 dental implants. So yes, that is true because we can angle the implants, as we said, and take advantage of the bone that you haven't lost.
So the people that are doing this, is it more men or more women?
Yeah, it's a 50-50 mix, Randy, and that's very simple. Tooth loss knows no boundaries. Men, women, old, young, white, black. It knows no boundaries, race, or religion. It affects everybody. I'll tell you about a woman we recently had. She came in, her husband dragged her in against her will, very depressed, hardly ever smiled. It was really difficult. Her son would often come, he had a baby with her, and she wouldn't even hold the baby. She was embarrassed to smile. The teeth would fall out when she would kiss the baby. She was a miserable, miserable person. She was very skeptical as well, like most depressed people are. They just don't believe. Well, let me tell you, 2 months after her surgery, she comes in. Her hair's done. She gained weight. She looks fantastic. Her husband is so happy because now he's no longer dragged down by this depressed person, and he's got his spouse back, the woman he fell in love with again. So yes, it's men, it's women, it's sometimes young adults too. Young adults lose their teeth for many reasons, trauma, accidents,
do they look real?
I
mean, what you've shown me so far, these look like real teeth.
Absolutely, they look real.
So it's a kind of a cosmetic component to this?
It's a very, look at the picture, Andy. Look at the way the lip is following the outline of the teeth, how the teeth fill up the smile, right? And you see gum tissue between each one of those teeth. That's what makes these bridges look so lifelike, so real. Nobody would ever guess that these patients have teeth that are prosthetics. They look and act like real teeth and gums.
Now with your center, you kind of have this team approach, you do it all right there.
Yes.
Is that right?
It's true, but we also have referrals that send patients in and then they do the prosthetic side.
So you can work with their dentist.
Absolutely.
Together.
Absolutely.
Okay.
Even if their dentist hasn't done one of these cases because we have a training facility.
Now, for the sake of time, I know you have more photos.
Right.
So what else do you have?
Here's another woman, Randy. Look at her. Look how she comes in, right? She's got a gappy smile. She doesn't feel very good about herself. Here's a woman who suffered with periodontal disease her whole life. She's out of the dating scene, refuses to date anymore. She doesn't think she can get a date anymore. Suffered with periodontal disease her whole life. Her whole family suffered with periodontal disease. So, loose teeth, bad breath, the whole 9 yards. Really, really reclusive person. Now, she comes to us. We say, of course, we can help. So, what we did for her, Randy, now she could have had a denture as well, but instead, we put the 4 implants in the top, 4 implants in the bottom jaw, and the same day, attached again, fixed teeth. She walks out. She can't believe how she looks. She comes back the next time, and she looks like this.
Wow.
It looks like a different person. Again, look at the smile. Look how lifelike that really is. Now, she's happy. She's confident. She's feeling better about herself, right? She's out there. She's out there dating again. She has a boyfriend now. So it's a life changer for these patients. And I can go on and on with stories like that. So look at the before and after side by side, Randy. Looks like a different person.
It does,
right?
actually.
Look at the detail, though. Look at the teeth, how they follow the line of the lip, fill out the smile. You see little pink gum triangles coming down between each tooth. That's what makes this so lifelike, because these teeth aren't long and square like chiclets like we sometimes see. Some people smile, looks like a row of piano keys in there. Not with these bridges, because there's a gum component on it. So there's a cosmetic benefit from this procedure.
So they
and there's no adhesive. This doesn't come in and out at night. There's no glue and paste. They're fixed to the implants. They are secured to the implants.
So their teeth could be a total mess, gum disease, bleeding gum, all that stuff loose, and those teeth extracted, they get a fixed set of teeth.
Absolutely. Teeth come out, clean out all the chronic infections in the jaws, clean everything up, get rid of that bacteria that can no longer colonize the mouth once the teeth are out. See, it's a fresh start. It's a fresh start for these patients. They have no more pathology anymore. Sure, if they never pick up a toothbrush again, odds are they're going to lose their implants at some point. But most patients are reinvigorated. They're motivated now to take care of this because they just can't believe how good they look, and they don't want to lose that once they've got it. And we touched on the point earlier where lack of bone sometimes can preclude a patient in some dentist's eyes. Well, let me tell you a story about a gentleman I had. He was 77 years old. As I'm finishing up his case, and we did upper and lower on him as well, and he was a denture wearer, I said to him, George, how long has it been since you had fixed teeth, no dentures? I thought he said 15 years. He says, Doc, as he grabs me by my shirt and pulls me in, 50 years. 50 years? How's that even possible? Well, in the Army, he was 27. They took out his last teeth. Common in the Army, they don't want to deal with bad teeth when you're off to war. Gave him dentures, and for 50 years he wore dentures. Why? Because everybody he went to see told him, you're not an implant candidate. Then he found us and we changed his life.
Is that right?
Absolutely. Now, he's eating foods he's been missing for 50 years, the foods we just mentioned, meats, nuts, fruits, vegetables, corn on the cob, all of those nice things in life. And there's benefits to that. What are they? A well-balanced diet, so we have better nutrition. We've got better health. Denture wearers can't masticate certain foods. So there's malnourishment in the elderly denture wearers all the time.
No fiber.
No fiber. No fiber. There's no teeth in the stomach, we like to say.
So 50 years with this guy, did they ever get frustrated? Because like you say that they're told elsewhere it can't be done. Did they ever say, I should have done this years ago?
Of course. Problem is, in this country, we're lagging behind in technology. All on fours now just sweeping the nation here.
And when you say all on four, that's a full arch of teeth on 4 implants?
Full arch of teeth on only 4 implants, strategically positioned, usually in the bone that has not resorbed away.
Okay. Now, I know you have another photo you want to show.
Yes, because I want to show you that this is not just a problem of the elderly.
Okay.
I mentioned earlier, people lose their teeth for all kinds of reasons. This one's a bit unfortunate. So here's a guy who was on some medications that just rotted his teeth. He's not even 35 years old. All of his teeth were rotten. He had them all, but they all rotted down to the nubs.
So they had to come out?
All of them had to come out. Not one tooth could be saved. So they all came out, again, the same day, 4 implants on the top, 4 implants on the bottom. Look at him now. Just look at his grin in the picture. Look how happy he is. And these teeth are built to last. Right? These are materials that are biocompatible. They're going to last for decades and decades.
He can chew whatever he wants.
Virtually anything he wants, yes.
Like a steak, corn on the cob,
absolutely.
a carrot,
Steaks, corn on the cobs.
Could he bite an apple with the front teeth?
He can bite into an apple typically the same day with the front teeth. Now, we don't advocate everybody go around biting into apples the first day. We haven't had that biological bond form. But many people can bite into an apple. That's how secure these implants go in.
If there was like a try-in period, like a tryout, like you said, there's like 500,000 people with an upper lower denture. If they knew how good this was, you guys couldn't even service all the people.
It'd be impossible. We would need hundreds of as many dentists as are out there. There's so many patients that are in need. So many, Randy. Here's one more I'd like to show you. Another woman who suffered with periodontal disease her whole life. Not an old woman, but she looks a little older than her real age in that picture. So her general dentist told her, all these teeth have to go. She said, what are my options? He said, dentures. She said, no way, absolutely not. I need to find a better solution. Did some internet research, found us, Malo Smiles. So here's what we did. We give her a fixed set of teeth on top, fixed set of teeth on the bottom, both in the same day. Now, she's out enjoying herself. She feels good about herself. Actually, this is a woman who had a hard time finding a job. Look at her picture now. She looks younger in this picture. Look how broad her smile is.
That's a beautiful smile.
That is an amazing, dramatic difference in this person's life. So it's a self-confidence builder. It's not only about being able to eat and chew and smile. It's about what it does to you on the inside, right? Builds your confidence. Let's talk about life for a second, Randy.
Okay.
If you are a person who's just not happy, you're overweight, you don't like your smile, those things hold you back, right? They hold you back from dating, from going out, being visible, being with your friends. It's difficult. Now, you change somebody's smile like that, and they see the difference it makes, and their friends and their relatives are telling them, wow, you look fantastic. That's an ego booster. They feel better. They feel confident. They go to that job interview and they're smiling. When I hire people that smile because I want positivity in the office. I don't want negative people. I want my patients to have a positive vibe when they come to our facility. Smiling patients give off that vibe. They give the sense to people that this is a well put together, happy, well-adjusted person.
For denture wearers, they
Sure.
come in. What are their options when it comes to dental implants?
The simplest, least expensive option is what's called an overdenture. 2 implants with clips on them that attach to a little ring in the denture, and they snap in and they snap out. And there's different tensions depending on your dexterity. That's option 1. Option 2, we can add a couple more implants and give you fixed teeth. Teeth that aren't removable. Sure, we could do 6 or 8, but it's not necessary. You don't need more than 4. So your options are removable denture on 2 implants or fixed teeth that no longer come in and out, and that is a world of difference in patients' lives.
Very nice. Okay, final message to somebody that maybe they haven't been to the dentist, because you say this happens. They haven't been to the dentist in 10, 15 years.
Happens all the time.
Their teeth are loose, okay? And then also the denture wear. They're watching this and they're still skeptical, or they're worried about pain or whatever. What's your message to them?
My message is do some research, find out about this procedure we've been talking about, or dental implants in general. We can do a lot of things. 1 tooth, 2 teeth, snap-on dentures, all of your teeth. So I would say get opinions, get second opinions, get third opinions if you're not getting the answers you want to hear, because odds are you're a candidate.
And you think that they should go to an oral surgeon?
I think that they should go to a specialist, whoever is in their area that's doing a lot of these procedures. You want somebody who's doing high volume, not somebody that dabbles.
And I guess oral surgeons, specialists, dentists from all over the world learn this.
Absolutely.
From you.
Come to our facility twice a year. We have these programs. They come from South America, Asia, Europe, all over the world, as you said.
So absolutely nobody should be wearing a denture.
Not today.
You think you're going to wipe it out in New York?
That would be nice.
One of these days?
That would be nice.
Is that the future? I mean, nobody, like in 20 years or 50 years?
I'm sure we'll be growing teeth in a petri dish in 15, 20 years, but right now that technology is not there. So implants is the way to go.
Same day. All right, I want to thank you for coming on the show.
It was my pleasure.
Excellent
Thank you
stuff.
for having me.
You've been watching The Wellness Hour. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.